Well, welcome to the webinar on reducing the risk of infection in the operating room. We have a multi-specialty discussion of some surgeons, and I'm an infection preventionist. We have with us Dr. Christopher Basile, Carlos Aguirre-Rieta, Kyle Muller, and my name is Maureen Spencer. So here are our faculty disclosures. And the program has been provided by the North American Center for Continuing Education, an HMP global company. It's also supported by an educational grant from Aerobiotics. So our learning objectives is to understand the risks of surgical site infections, particularly in lengthy procedures, identify various ways to reduce surgical site infections, and understand the difference and impact of non-turbulent air purification during a surgical procedure. So I'm going to turn it over now to our first speaker, who's going to be talking on surgical site infections in neurosurgery, Dr. Kyle Muller.
All right, well, thank you very much for the opportunity to present here on this important subject matter. Back pain and neck pain is obviously a major source of disability in the United States. It's very common. And the US spends a drastic amount of money on this. And even though a small fraction of these patients will undergo surgery, that still ultimately becomes a big source of healthcare utilization. And many of these patients fortunately do well, but there's still the risk of developing a surgical site infection. And we should be concerned with this because it does impact all of us. And unfortunately, attention to the optimization strategies has historically been lacking, especially in the field of neurosurgery and spine surgery. And there's many factors related to wound complications that can be a source of discomfort to the patient, to their family, and to the healthcare system in terms of costs. And as we've transitioned to more value-based healthcare, spine surgery has become a focus of how we can provide better care to these patients. And on that front, there's been some studies that have looked at what are some quality improvement benchmarks that we can use as standards. And so the National Healthcare Safety Network report is one of the initial ones that came out. And it showed that for a simple laminectomy, it was about a 1% risk of an infection, fusion up to 2%, and a revision fusion up to 3%. And unfortunately, what many of these initial databases